Hi everybody, Ziv here, and in this video I'm going to talk to you about ridge collapse and the anti-collapse extraction technique. I'm also going to talk to you about my new extraction book called The Perfect Pull and what's in it. It's coming out shortly, so I'm super excited to share this with you. And in this book I'm sharing my 25 years in exodontia and what every dentist needs to read and implement as you go through the chapters in this book, so that you can gain the same clarity and the same confidence as a surgical specialist. In the book, I have 9 chapters. We're starting with a chapter on how to turn chaos in extraction into an extraction system. Then I talk about the different extraction enemies and how to prepare for them. In the previous video, I talked to you already about some of the engineering principles and the forces that you need to use, and that's in chapter 3. How to prepare for the procedure, create that final check before you perform your perfect pull, how to optimize your patient's healing and the healing blueprint, how to handle complications and stay calm with grace under pressure, and then give you the summary on how to implement it in your practice and the important concepts that you need to know. So it's coming out shortly, stay tuned, and I'm super excited to get it into your hands. Now let's talk about ridge collapse. Many dentists think ridge collapse happens later, over weeks or months, but the reality is it starts during the extraction. With one careless movement, you can destroy the buccal plate, you can damage the soft tissue, you can damage the papilla, and it's very hard to overcome this. Most of us dentists are nervous about seeing cases like this one with severe resorption, or this one with fully broken coronal portion and a curved root or close to the sinus. So you either take these cases and refer them to perio-oral surgery, or you give it a try and have a ridge collapse. Now, you don't always see ridge collapse right away, but fast forward 6 months and you're staring at a collapsed ridge, no soft tissue, no volume, and a compromised implant site. And the patient is looking at a compromised result, wondering, why doesn't it look right? Why is it so complicated? Why does it take so many months? The problem is no one taught us how to protect the ridge while extracting the tooth. That's why I created the anti-collapse extraction protocol, or ACE, anti-collapse extraction. So I wanted to share with you the principles of the anti-collapse, like I share it inside the Perfect Pull book. In the Perfect Pull, I map out exactly what needs to happen to preserve the ridge, where to apply the pressure, where not to apply pressure, how to avoid crushing the buccal plate, when to leave the shield, how to leave the shield, how to process it, when to graft, when to reflect the flap, and when not to flap, depending on the case. So let me give you an example from the book. This is a case of a maxillary central incisor. It broke at the bone level. You see that the tooth is root canal treated and compromised. So the first step is to create your mesiodistal split. You split it all the way to the apex of the root. Once you created the split, you can remove the palatal segment of the root, and then you process the buccal ACE fragment by bringing it to bone level, by thinning it out to a 1 millimeter thickness, and by creating a bevel on the occlusal. In this case, I was able to place an immediate implant, fully guided, and did some gap grafting. And as this case healed, you can see that the buccal contour of the bone and the soft tissue was preserved in thickness, but also in height. So it's certainly a great result for anybody extracting teeth, especially in the aesthetic zone. Most of the aesthetic failures I've seen didn't start at the implant stage or because of the implant placement. They started at the time of the extraction. And if you want to be able to do simple and difficult extractions with the same level of calm and preparation, and do extractions like this one where the tooth has severe resorption and you're wondering how can you take this tooth out atraumatically and graft the site, or an extraction like this when the tooth is fractured subgingivally, or multiple teeth that are broken subgingivally, or a case where you have a broken root close to an adjacent premolar and you need to remove it very carefully and atraumatically, or a root that is close to the sinus, you need to be careful about the anatomical structure. If you want to do all of the above cases, that's exactly what the Perfect Pull book gives you. It's a system to preserve the ridge and protect the future site. We don't pull teeth blindly, we extract them with a plan. So this book is coming out soon, and if you care about long-term outcomes, ridge preservation, and aesthetics, this is something that I want in your hands. So stay tuned, it's coming soon.